Hi, I'm Dr. GB. It's nice to see you. Could you confirm your name for me? Perfect. Okay. So we are doing a full comprehensive orbital exam today. It's going to be a little bit different than what you might be used to in terms of just like your routine eye exam or maybe your exam to get glasses or contacts. This is going to be more about your vision. So we'll do a few vision tests that you might be familiar with. But I'm going to be pressing on your eyes, around the bone structure about your body. I'm going to do a bit of a jaw check and just be checking the pressure of your eyes as well. None of this should be painful in any way. If it is, please don't hesitate to tell me, because that is something that I will note so we can look into that. Alright, I'm going to start off with a few questions. Are you nice and comfortable? Okay. Have you had any recent trauma to your face? Okay. Are there any possibilities for any foreign bodies being present in your eye or possibly in your skull? You'd be surprised what we see here. Do you have any history of ocular problems, vision problems, anything that you think that I could or should be aware of? Okay. Are you on any medications, anything at all, not necessarily related to your vision? Okay. Okay. Do you have any past diagnoses that I should be aware of, or any past surgeries that I should be aware of? Yep, okay. Okay. At the moment, are you in any pain? And if you could give that a 1 out of 10. Okay. Any differences in your vision at the moment than what you normally experience? Anything that you're concerned about or changes that you've noticed? Have you noticed any swelling? Okay. All right. Thank you so much for being patient with me and answering those questions. I'm going to start off by looking for some pupillary defects. I'm just going to be shining this very bright light, apologies in advance, into your eyes. I'm going to be checking out your pupils. So I want you to stare off into the distance, okay? You don't have to look directly at the light at all. I'll be bringing it into your field of vision, but I don't want you to have to focus on the bright light. Okay. So I'll be looking at not only the pupil that I'm shining the light in, but also the pupil that I'm not shining the light in, to make sure that they're reacting how they should, and making sure that they're symmetrical. Okay, very good. You can go ahead and relax. Right now, I just want you to do a few exercises for me. Let's go ahead and close your eyes. Okay, open your eyes. Very good. Can you look up for me? Look down without moving your head. Look to the side and to the other side without moving your head. Okay, wonderful. I'm gonna go ahead and relax. I'm gonna go ahead and have you follow my finger. Just with your eyes, if you can keep your head as steady as possible. I'm going to do that again. I'm going to go ahead and hold your eyelids open very gently. Is that okay? And I'm going to have you follow my finger again. Okay, very good. Sometimes it's hard to see the eye moving down when you look down because your eyelids cover it. So we have to hold up the eyelids. Okay. So all of your positions of gaze look good, nothing inconsistent. I'm going to go ahead and get some measurements with my exophthalmometer. There's just a fancy word for measuring tool that I'll be using. So I just need you to position your head and your neck as naturally as possible. Now these points are going to go on either side of your eyes. If it's uncomfortable, just let me know, but it shouldn't be. I'm just going to need to slide this. Okay. I'm going to make a note of the measurements. Okay. And we're going to do this again. But this time, I need you to build up some vascular pressure in your face. And to do that, I basically just need you to make your face red. So have some pressure built up. So I want you to lean over. Okay, hold your nose with your fingers and blow like you're blowing up a balloon or something. Okay, now if you can just hold this for 20, maybe not even 20 seconds, I think 10 seconds is usually enough. So just hold your nose and blow. 9, 10. Okay, very good. You can go ahead and relax. A lot of people don't like doing that. I'm just gonna go ahead and get a second measurement here. Okay. Okay. Thank you, thank you. Okay. I'm gonna go ahead and check for any abnormalities or anything that we should be concerned with behind your eyes, just by having you close your eyes. And I'm going to use my thumbs to very gently just press on your eyes. I'm not going to put a lot of pressure on at all, but I just want you to keep your eyes closed, relaxed. Okay, go ahead and close your eyes. And I'm going to do both at the same time, which helps me determine if there are any inconsistencies or if it's not symmetrical. I don't feel anything to be concerned about. Okay, very good. You can open your eyes or keep them closed because I'm just going to check the bony rims around your eyes. So I'm just going to make sure that all of this is intact. No fractures, swelling, or anything that we should be concerned about. So go ahead and just feeling around on the tops. And then I'm going to go down your nose here, and then under the eyes here. Okay, I don't feel any abnormalities on the nasal bridge. I don't feel any abnormal notches or anything. It seems like you have a little bit of an inconsistency on this side. So I'm just going to note that, but it's nothing to be immediately worried about. Have you ever had any trauma to your face on that side in particular? Alright, let's test your facial sensation. So I'm going to be doing V1, V2, and the V3 zones. I'm just going to use the backs of my fingers, and I want you to tell me if it feels the same on both sides, and of course, importantly, if you can feel it at all. Okay, so I'm going to lightly touch the skin on your forehead. Did that feel the same on both sides? Okay. Next, over your nose bridge and then your cheeks. I'm going to lightly touch both sides. Did that feel the same on both sides? Okay. And then here along your chin and jawline, I'm going to go ahead and lightly touch both sides. Did that feel the same? Okay. Alright, next we are going to be checking your facial strength, checking for any facial nerve injuries, again, inconsistencies, weaknesses, etc. So that means we're going to do a couple more exercises. So go ahead and raise your eyebrows up, furrow them down. Very good. Now I'm going to ask you to tightly squeeze your eyes shut. Keep them closed. I'm going to try to open them. Keep them closed. Good. Okay, you can go ahead and relax. Sometimes when a patient has a trauma or weakness, they are unable to keep one of their eyes closed. Sometimes both, but usually what we see is trauma on one or the other side. Okay, so let's move down to your jaw. So if you just clench your jaw, does your jaw feel aligned for the most part? Okay. Do you feel any pain when you bite down? Good. Okay. I'm going to check your maxilla instability. And that just means I'm going to be putting a gloved hand in your mouth above your teeth. So up above, kind of like where your gum line is. And I'm going to very gently move my hand back and forth. Like really gently. Your neck shouldn't move at all. But I'm going to make sure that there's no instability here that could be affecting the orbital zone. Okay, so I'm going to put my hand in your mouth and just very gently. Okay. Some people are surprised when we check the mouth and the jaw during an orbital exam, but it is certainly all connected. Okay. You're doing really well. Thank you so much. Are you comfortable still? Good. Okay. Next, I'm going to be putting a stethoscope on your eyelids. You ever had that done before? This is just a precaution to check for any vascular tumors. I'm going to listen for any bruits that I hear, potentially behind the eyelid. So I just need you to, again, close your eyes, and I'm going to take a listen, okay? Very good. And the other eye. Very good. Nothing abnormal. I don't hear anything that's concerning. Okay. I'm going to have you do a more typical eye test. I'm going to have you hold this in front of either of your eyes. I'm going to ask you to read this chart. So go ahead and take this. hold it in front of. Let's do your left eye. Cover your left eye first. With your right eye, can you tell me the smallest line you can read and then read it out loud for me? Can you read this line? Okay. Can you read this line? And give it your best shot. Okay. I'm gonna have you switch eyes, so go ahead and we're gonna take that one and move it to this right eye over here. So now I want you to read with your left eye the lowest line you can read. Can you do this one for me? And can you read one lower? Go ahead and give it your best shot. Okay. Okay. You can keep that on your right eye. Still with your left eye. Slowly follow the light here. Okay, very good. I'm gonna have you go ahead and switch from this eye to covering your left eye, and I want to do the light test again with your right eye. So we're gonna start in the center. Follow the light. Very good. Follow the light. Very good. Very good. And here. Okay. And then around slowly in a circle. Very good. You can go ahead and uncover your eye. Take that from you. Okay. I'm going to check your optic nerve by doing a few small tests. Now, this one I'm going to be covering your eye for you. And I want you to tell me, with this eye covered, what color pen is this? Good. Okay. Cover your other eye. And I want you to tell me, what color pen is this? Okay. Were they the same color? Were the reds different? Okay. All right. Once again, I'm going to cover your eye for you. And I'm going to move this light into your eye. Okay? I'm going to cover your eye and move this light into your eye. Was one of the lights brighter or dimmer than the other, or were they the same? Okay. Okay. Usually if one of them is or appears dimmer to our patient, we can ask, because it's a fairly subjective test, what percentage dimmer or brighter the one side was. Okay. I do want to check your peripherals, your focus, and then we're going to just test your pressure inside your eye. I'm going to give you some eye drops for that, and then we can send you on your way. You should be good to drive, or if somebody's picking you up, that's good too. Okay. So with this peripheral check, I want you to go ahead and stare right at my nose, okay? I'm going to hold my hands up, and I want you to tell me, while looking at my nose the whole time, don't cheat, how many fingers I'm holding up, okay? Alright, here we go. Good. 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 Can you do the same thing, but with one eye covered? Okay. Here we go. Good. 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 And then, of course, let's cover the other eye. Here we go. Good. 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 Perfect. Good. Okay. Sometimes I can't hold my fingers up how I want to. You go ahead and uncover your eyes. And once again, I want you to look at my nose. I'm going to have my two fingers here. And I'm going to be wiggling them out of your vision. When you can't see my fingers anymore, let me know. Again, stay focused on the center point. Here we go. Good. 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 Perfect. Okay, time to cover that eye. We're going to do the exact same thing. Now that you know what to expect, let me know when you can't see my fingers anymore. Now, okay. Okay. There. Right there. Okay. Go ahead and cover your other eye. Let's do this one more time. Okay. Okay. Very good. Okie dokie. Go ahead and uncover your eye. I'm going to take this red pen again, and I'm going to be bringing it closer to your face. I want you, to your best ability, to stay focused on this pen. Are you ready? Okay, very good. Go ahead and cover your eye. Okay, and your other eye. Okay, perfect. So we're going to have you slightly tilt your head backwards, and we're just going to drop and drop, and be a little cotton ball here. Okay, and let that sit for a moment. And then I'm just going to be getting a pressure reading. I'm going to very, very, very lightly touch the surface of your eye. These drops should make it so you don't feel a thing. Okay, let's go go ahead and look straight forward or wherever you're comfortable. And I'm just going to. Okay. Very good. And let me write down that reading. Now for your other eye. Okay. Let me write down that reading. Okay. Now I want you to look up, okay? We're going to do the same thing. Okay. Look up and let's do the other eye. Okay, very good. Okay, that got well again. Alright. Now, do you have any questions for me? We should have your results soon, and then if I need to refer you to another doctor, I will, and I can just give you a call, or does email work better? Okay. Alright, well, thank you so much. It was a pleasure to meet you, and I hope you have a wonderful rest of your day. Thank you so much for coming.